Okay. Yes. Okay, done. Good afternoon. Today, let us discuss about some other pesticides which are widely used and of course used for the purpose of control of the pests, but some of them are very popularly used for the purpose of committing suicides. You must have heard certain popular names like Baygon spray, Tick 20, DDT, Gimexon. They are all household names, and even some other very popular insecticide which was widely used as an entry. I think at least some of you must have heard about these products which are used for the purpose of committing suicides. So let us come to the carbamates. The carbamates are the derivatives of carbonic acid, and they are marketed in the form of dust or even liquids. Their compounds are aldecarb, which is available as Temix, aminocarb, which is known as metacin, and aprocarb, which I was just telling about. A Baygon spray is aprocarb, and carbaryl 7, and even carbofuron, which is available as furoxidone. These are the popular brands of carbamates which are used as the pesticides, mostly sometimes even as the domestic insecticides. Absorption of these chemicals is again through all the forms. All the forms I mean through inhalation, by contact, or by taking orally, that is by ingestion. So it is absorbed through all the surface of the body, through respiratory tract, through mucous membrane, through the skin. So the absorption is through all the roots. And some of these like carbaryl, carbofuron, which I was just telling, and methomyl, they are highly toxic. And some brands here like aldecarb, carbendazim, and trialase, they are moderately toxic. Then what are all the things which are known as highly toxic, moderately toxic? For this you should know the classification, or otherwise called toxicity rating, given by the insecticide rules of 1971. So they are graded as extremely toxic product, which is extremely toxic when the toxic dose or the lethal dose is from 1 to 50 milligrams per kg body weight. If that is the lethal dose, yes, it is known as extremely toxic. And highly toxic means when the LD, that is lethal dose, is from 51 to 500 milligrams per kg body weight. This is known as highly toxic product. Moderately toxic when the dosage varies from 501 to 5000 milligrams per kg. And very slightly toxic is anything more than 5000 milligrams per kg body weight. So the highly toxic product, just I was telling, is carbaryl and carbofuron. That is the lethal dose varies from 51 to 500 milligrams per kg. And moderately toxic and slightly toxic are aldecarb, carbendazim, and trialate. So these are all among the carbamates which are the products which are available and their toxic doses and toxicity gradings. I told you these products are absorbed through all the routes. And what is their chemical action? They are also acting, they inhibit carbolic esterase enzymes again, and the process of inhibition is through carbamylation. So, since it is also cholinesterase inhibitor, all these pathological effects or the symptoms and signs are definitely related to excess of accumulation of acetylcholine. That is, in other words, the signs and symptoms almost will be like that of organophosphorus poisoning only, which we have discussed in the last class. So the symptoms begin in as much as 15 minutes up to the 2 hours of exposure. And here, one difference between OP and OP, these organophosphorus compounds, and the carbamates is, here they spontaneously hydrolyze from the cholinesterase enzymatic site within 24 to 48 hours after exposure. Hence, the action of the toxicity or the toxic reaction of the carbamates will be for a short duration and also little less severe when we compare to that of the organophosphorus compounds poisoning. And second thing is, these carbamates do not effectively penetrate into the CNS. Hence the CNS toxicity is limited, and rest other symptoms, that is those related to nicotinic and muscarinic action due to excessive accumulation of acetylcholine, will be similar to that what we have seen in organophosphorus poisonings. I told you the GA symptoms. You remember the mnemonic sludge, that is salivation, lacrimation, salivation in the sense excessive salivation, excessive lacrimation, urination, emesis. See, all these symptoms which we were asked you to remember by the term the sludge. So these are present in carbamate poisoning also. The nicotinic action probably little less, but yes, they have weakness, paralysis of the skeletal muscles, striated muscles, they develop ataxia and all the other symptoms which we have discussed while we were talking about organophosphorus compound. The only difference is they are little less severe and the duration is short because there is a spontaneous hydrolysis at the cholinesterase junctions. The treatment in organophosphorus poisoning remains same, that is the antidote is atropine, that is the specific antidote. I told you atropine has got exactly similar effect of that of acetylcholine on the body. I also told you, you remember it as the best physiological antidote which are used in the toxicology. And pralidoxim also can be used here. This will help in reducing the severity of the symptoms, and also it may help in reducing the morbidity of an individual, and it also improves the respiratory function and the feeling of well-being of an individual. So this is all about the carbamates. And one product which was very popular when it was available as the Baygon spray. Baygon spray is Apocarb. I told you it was used for the domestic insecticides couple of years back, or maybe last decade. There used to be many cases of poisoning with Baygon spray because it was almost a household commodity where they used to spray for the domestic insects, for flies and for ticks and all that. So we used to get a lot of cases of Baygon spray poisoning. But now maybe now it is replaced with the mosquito coils, mosquito repellers. See, as the technology improves, of course, though the safety profile also increases, but people still even today come with taking mosquito repellents and whatever is available they bring and come with the effects of toxic symptoms. So remember, the antidote here is an atropine. Atropine is to be given IV infusion till you get the desired effect. The effect of atropinization launches, and then also I told you take pralidoxim, and other clinical manifestations are to be managed depending on the individual case, its presentation and the response to your treatment. The next class we discuss here is organochlorines. These are also popular brands. We see what are all the organochlorines which we use day to day. Some of them, of course, maybe in agricultural use, but some of them we also use for the domestic purpose. And these organochlorines, they are chlorinated carbons, and they are divided into 4 categories. They are the chlorinated carbons, which are divided or which are classified into 4 categories. Number 1, the most popular DDT and analogs. Day in and day out, the DDT, you must be heard, they are sprayed very widely even by the municipalities for disinfectant, by the all the sanitary workers. They use DDT spraying, DDT powder and its analogs. They are class number 1. DDT, methoxychlor, they become in the DDT group. And 2, the benzahexane hexachloride and gamma hexachlorobenzenes and the lindane. See, the gamma-hexane, gamma-hexane benzachloride and benzene hexachloride also are the popular products which are organochlorines. Number 3 is the cyclodine and related compounds like aldrin, chlordane, chlordecone, deldrine, and endosulfan. Of course, it's most popularly used in the agriculture. Endosulfan, you must have heard, popularly sprayed on even the chlorine plants, endosulfan. And isoben and many other products. And 4th class is the toxofen and their related compounds. So these are the 4 classes which we discuss under organochlorine compounds. See, there are many popular products which you heard day in and day out, like DDT, like gamexon, and like endosulfan. These products you must have heard. And all these pesticides, they are absorbed through the skin. They are absorbed when taken orally and also when they are inhaled. So these pesticides also are absorbed through all the roots, and DDT is the least well absorbed out of all these things. And these agents are highly lipid soluble. And how they are metabolized? These products are metabolized in the liver, and their metabolites are directly excreted in the urine, feces, Endrin is rapidly metabolized and eliminated, and it does not persist in the body tissue. What is the mechanism of action of these substances when they enter into the body tissues? They interfere with the nerve impulse transmissions. CNS is first stimulated, followed by depression. Initial stimulation for some time, then subsequently the CNS gets depressed. So the action is mostly on the central nervous system, initial anxiety stimulation, and then followed with the depression and coma depending on the dosage, and the patient may die because of serious vital depressions. All the vital centers are present in the brain, so the depression causes maybe respiratory depression in the centers. The fatal dose, the DDT 30 grams, not milligrams, it is 30 grams, Gamexon 50 grams, Lindane 15 grams, and Chlordane 30 grams. See, this Gamexon is popularly used as the ant killer. They sell in the market also Gamexon powder just to kill the white ants and also regular ants. That's the many people use in the domestic purpose, in the roof gardens, in the plants in front of your homes, and sometimes they to escape from the ant menace they use Gamexon powder, which is popular as a Chimalman. Chimalman is sold everywhere in the market. That is Gamexon. Now let us talk something about Endrin. Once again, Endrin was widely used insecticide since it has got a very broad spectrum of activity, like our broad spectrum antibiotic. Penicillin was widely used a decade or 2 decades ago actually, Endrin. So it was also known as plant penicillin. Penicillin was very popular and highly effective antibiotic when it came into the market, penicillin, and it has got a very broad spectrum of antibiotic, and in fact penicillin was the drug of choice for any infections. Even when we started our clinical practices during 70s, the antibiotic penicillin was the best antibiotic which controlled many of the infections. Of course, now the scenario has changed. The usage of penicillin has come down drastically now for various reasons. One, because of many other safe antibiotics have come to the market with a broad spectrum of activity, and one problem used to present with the penicillin was anaphylactic reactions. So because of availability of various oral antibiotics, higher antibiotics, the role of penicillin has definitely decreased. Anyway, coming to the Endrin, which was popularly known as a plant penicillin, it is a polycyclic polychlorinated hydrocarbon, belongs to cyclodine insecticide group, and it is the stereoisomer of delidrin. And this Endrin is soluble in aromatic hydrocarbons and ketones, and it is sparingly soluble in alcohol, but it is insoluble in water. By taste, it is bitter in taste, and I told you it was popularly known as a plant penicillin. And the trade names of Endrin was Endrin WE16, Endox DB50, Endotox EC20, Endrex, Talfdrin. They were very popular products. They contain about 20 to 50% of the Endrin mixed with petroleum hydrocarbons, I told you, such as Aromax. And wherever the solvent is Aromax, you know that it smells like kerosene, and it is commonly used as a spray and as a dust, and it is mixed with inert clays when it is used as a dust. Once the person is exposed to the toxin, that is Endrin, even if we ingest it or inhales it, the symptoms develop within 1 hour even maybe up to 6 hours. The chief presenting symptoms would be excessive salivation, nausea, vomiting, abdominal pain, and sometimes even with the symptoms of diarrhea the patient will come to you. These are all GI tract related symptoms. The patient may come to you with hoarseness of voice, even with the bouts of coughing, and there may be froth from the mouth and froth from the nose, causing respiratory distress, and the patient may present to you with the complaints of dyspnea, of this breathlessness. He may be coming to you with the CNS symptoms like headache, giddiness, restlessness, and hyper irritability, and there may be signs of incoordination. The incoordination, ataxia, mental confusion, tremors, and there may be even tonic or clonic convulsions. And in severe cases, the patient may go into the coma, and in fatal cases, the death is usually due to respiratory failure. If the patient survives because of less toxicity or less intake of the poison or less exposure to the poison, that is in non-fatal cases, most of the persons feel well only after 24 hours. So the symptomatology is again involves gastrointestinal tracts, respiratory tract, and again CNS depression. In chronic poisoning, when there is a long-term exposure to these compounds, the long-time small doses of exposure will lead to cumulative toxicity, which is characterized by loss of weight, weakness, ataxia, tremors, and there may be behavioral mental changes. Sometimes the patient also develop oligospermia. Oligospermia is decreased in the sperm count, so he may become sterile, and increased tendency is also there. See, there are cases where they develop leukemias. The development of leukemia due to chronic exposure to the enterin also was noted, and even there were the cases of purpuras, aplastic anemia, and sometimes there were cases of liver cancer or malignancy in the liver. So these are all the clinical symptoms or the after effects of exposure after the entry, acute and chronic exposure. The fatal dose is normally 5 to 6 grams by injection. And the fatal period is 1 to several hours. In the fatal cases, when you examine the case at autopsy, that is your post-mortem findings, the mouth and the stomach contains the smell of kerosene. I told you because it is solvent is Aromax, which smells like kerosene, and all the signs of asphyxia are present in the viscera. Like as you see in organophosphorus compound poisonings, the smell of kerosene in the say the secretion from the mouth or the nose, and when you open the body, even the viscera, it smells like that of kerosene, and all the viscera are congested, increased permeability, increased vascularity and sloughing. All the findings what you have seen in organophosphorus poison also will be seen in the enrine. And one characteristic of the enrine is the enrine resists the putrefaction, and hence it can be detected in the viscera for a longer time after death. So the putrefaction is resisted or delayed in enrine poisoning. And what is the treatment? I told you again, what you have learned in general toxicology or what you are doing in organophosphorus poisoning. The clothing should be removed and the skin washed with the soap and water, I told you. That is decontamination. And the gastric lavage, the stomach can be evacuated with emetics. I told you the ipecac guana is the best emetic available. And if it is not available, I was also telling you about the physical method of inducing vomiting. Gastric lavage is indicated. You can do gastric lavage and give activated charcoal, which is a very good absorbent. I told you it will absorb all the remaining poison in the stomach. Cholestyramine is a non-absorbable bile acid binding anion exchange resin that increases fecal excretion of organochlorides. That is an enrine here. And there is no specific antidote for enrine. Since there is no specific antidote, you have to manage the case depending on the clinical presentation. And the criteria I told you once again, for the cost of reputation, airway, breathing, circulation, and taking care of neurological symptoms. So maintain the adequate airway, breathing and circulations. The mental state is altered. You can give what I mentioned in the general toxicology, something like coma cocktail, that is, which contains dextrose, naloxone, and thiamine is administered in this poisoning. And if there are any seizures or convulsions, you may give diazepam or metsalam. That is the clinician's choice, whichever is available. And depending on the other symptomatology, you will have to treat the patient. What is the source of poisoning? How it happens? Human poisoning occurs from occupational or accidental exposure to the poison enrine. I told you it was one of the commonest mode or commonest agent taken for the suicides. I heard many cases dying due to enrine poisoning. I have seen some cases also. I have attended some cases during my clinical career. But now I don't see a lot of maybe the enrine product, because it has become very popularly used suicidal agent. I think it is not available now mostly. And since it is a bitter in taste, it cannot be given as the homicidal agent. But sometimes people do try to give it as homicide by mixing it with some food or sweets, or even with alcohol they have given. So this type of homicidal case also was noticed, though little rare. So this is how we are supposed to know something about the enrine. And today I will also discuss one more popular product, that is the aluminum phosphide, which is aluminum phosphide. Now it has become a latest suicidal agent, especially in the central and north India. Now people are taking aluminum phosphide to commit suicide. It has become a more popular drug they are taking to commit suicide. It is aluminum phosphide is a solid, a fumigant pesticide. Pesticide, it is an insecticide, it is also rodenticide. I told you it is used to kill the rats and pests also. It is a fumigant. So they used to put these aluminum phosphide tablets into the holes wherever they see in the agricultural fields, put 2 or 3 or 4 tablets and close the way, the opening, and because of the released gases the rodents used to die. It is a popular rodenticide. It is also insecticide and it is a pesticide. Phosphate and the hydrophosphate of aluminium, which are non-toxic residue of aluminum phosphide. Phosphite and hypophosphite. Now this aluminum phosphide also used to store the grains. See, the grains also, they get worms and all insects in the grains. To kill that, it's used in the storage of the grains, but because of the decomposition of the aluminum phosphide, the non-toxic product like phosphate and hypophosphates of aluminum, they are left in the grains. In India, the aluminum phosphide is available as a white tablet of Cellphos, Allphos or Quickphos. It is also available as Phostoxin or Phosphotex, and each tablet will be weighing around 3 grams, and it has the capacity to liberate 1 gram of phosphine, and phosphine is the poisonous substance. And this aluminum phosphide has got a garlic odor is the characteristic odor of aluminum phosphide tablets. On coming in contact with the moisture, this aluminum phosphide liberates phosphines, I told you, and phosphine, it inhibits the respiratory chain of enzymes, and it has got a cytotoxic action also. It acts by inhibiting the electron transport resulting from preferential inhibition of cyclochrome oxidases. Phosphine is a systemic poison. I told you phosphine is released with aluminum phosphide, and I told you each 3 grams will release about 1 gram of phosphide. So the phosphine is a systemic poison, I told you, and after affects all organs, then it affects all organs in the body. The chemical reaction is accelerated by presence of hydrochloric acid in the stomach. So if it is taken, ingested, the tablet, its action is potentiated in the presence of hydrochloric acid. So phosphine is rapidly absorbed from the GI tract by simple diffusion, and it causes, I told you, damage to all the internal organs. It is also absorbed by inhalation through lungs. And some of the aluminum phosphide which is ingested is metabolized in the liver, where phosphine is slowly released, accounting for the prolongation of the symptoms of phosphine. And the phosphine is very slowly oxidized in the body into oxyacids and excreted in the urine as hypophosphite. the excretory product of the aluminum phosphate poisoning or intake, after metabolized in the liver, it is excreted as hypophosphate in the urine. And sometimes it is also excreted unchanged in lungs through exhalation when they breathe out. And the fatal dose of aluminum phosphate is 1 to 2 grams. That is 1 to 3 tablets is enough to cause death of an individual. And inhalation of phosphine at a concentration of 4 to 600 ppm is fatal within 1 hour. Normally the fatal period is from 1 to 4 hours, and majority of the patients will die within 24 hours. The signs and symptoms depends on the dose and the severity of the poisoning. Mild inhalation exposure produces irritation of the mucous membrane, and it may also go to the acute respiratory depression, or ARDS we will call it as acute respiratory distress, not depress, sorry, acute respiratory distress. Then other symptoms like dizziness, fatigue, tightness in the chest, nausea, vomiting and diarrhea, and sometimes even headache may be the simple symptom depending on the dose of exposure of the poison. And if there is a moderate toxicity, they produce ataxia, I told you, the numbness, paresthesias, tremors, the double vision or diplopia, and sometimes even they develop jaundice, muscular weakness, incoordination and paralysis. See, this presentation may be in moderate exposure to aluminum phosphate poisoning. Concentration of pH in air higher than 0.3 ppm, it causes severe illness. Severe toxicity causes, I told you, acute respiratory distress syndrome, ARDS. And normally people, they have a lot of problem in ARDS, and people succumb to the fatal and they become fatal also. And they may develop cardiac arrhythmias, acute congestive heart failure. The patient may develop pulmonary edemas, seizures or coma and death. And if it is ingested, orally taken with mild, it produces nausea, headache and abdominal pain. I told you, if it is a mild intoxication, and with mild intoxication normally the patient will recover. If it is a moderate or severe poisoning, the systemic manifestations are progressive and mostly they are fatal. The GI symptoms like nausea, vomiting, diarrhea and the retrosternal pain also they develop in moderate and severe poisoning. And they may develop hypotension and shock due to hypotension. I told you arrhythmias, they also may develop myocarditis, the inflammation of myocardium, pericarditis and also acute congestive heart failure. These things, when they ingest or take aluminum phosphate tablets in a reasonably big quantities, when we call it as a moderate or a severe poisoning. In respiratory system, they may develop severe cough, dyspnea because of, or they even develop cyanosis, pulmonary edema leading to respiratory failure. I told you like that in inhalation they may even develop jaundice, they may develop acute hepatitis or hepatomegaly, that is enlargement of the liver, and they may even have the renal failure, acute renal failure. ARF also is a symptom, a manifestation in acute aluminum phosphide poisoning. And serious symptoms of nervous system are very common. They are headaches to start with, they will have severe dizziness, altered mental status, restlessness, and because of hypoxia even they may develop seizures, convulsions, and acute hypoxic encephalopathy. The damage of the brain due to decreased oxygenation, we call it as acute hypoxic encephalopathy. Even they may go into the coma. Some rare symptoms like muscle wasting, which is chronic, mild, and tenderness and bleeding diathesis because there was the widespread capillary damage, and cardiogenic shock. See, the shock due to cardio problems, we call it as a cardiogenic shock. I also told you the hypotensive shock, circulatory shock due to hypotension, and here the most common cause of death is cardiogenic shock. I told you because the complications like pericarditis, myocarditis, and acute congestive failure are also seen. Mortality in aluminum phosphide is as high from 35 to 100%. So the mortality rate is high. So the availability is there. It is used as a tablet, easily available, high mortality. Hence, the aluminum phosphide has become a very popular suicidal poisoning in India, especially in North Indian and Central Indian parts. The treatment in aluminum phosphide poisoning is gastric lavage with potassium permanganate, and it can be repeated 2 to 3 times to oxidize the poison whatever is present in the gastric or stomach contents. Then of course you have to give activated charcoal up to 100 grams because this is the best. Activated charcoal is a very big absorbent, it absorbs all the remnant poison. And I told you when I am speaking in general measures of gastric lavage, you should leave some antacids because they also reduce some symptoms and also reduce absorption of the plasmin. Some liquid paraffin also is given for excretion of aluminum phosphide. And again, even in aluminum phosphide there is no specific antidote. Hence we will manage depending on the clinical presentation and the systems involved in the individual. The magnesium sulfate, it reduces organ toxicity and it also corrects the hypomagnesemia, which is a finding in aluminum phosphide poisoning. So substitution or giving magnesium sulfate, that will correct the hypomagnesemia and it also reduces the organ toxicity and also arrhythmias. And the usual dose is 1 gram repeated for the next 2 hours and then 1 to 1.5 gram every 6th hourly for 5 to 7 days, and it can be given in the form of continuous IV infusion. So you remember here the magnesium sulfate is indicated during treatment of aluminum phosphide poisoning, and it can be given for a period of 1 week as an infusion, and monitoring the clinical development and the symptomatology in an individual. And treatment of shock depends if it is an hypotensive shock, hypovolemic shock, and to treat the shock 4 to 6 liters of the fluids are to be administered in first 3 to 4 hours, and half of this fluid should be normal saline only. And because I told you the hypotension and the other infection and the other effects on the cardiac muscles, they also give low doses of dopamine. Dopamine is given in a dose of 4 to 6 micrograms per kg as an infusion, and intravenous hydrocortisone. See, hydrocortisone is a good anti-inflammatory steroid. So the IV hydrocortisone of 400 milligrams strength at every 4 to 6 hours is highly effective in treatment of aluminum phosphide poisoning, because it also reduces the dose of dopamine, and if there is hypoxia due to respiratory depression, of course you will have to administer oxygen, and the shock should be treated again, I told you, with the fluids, IV fluids and hydrocortisone. And if there is any metabolic acidosis, it should be corrected with IV sodium carbonate. And depending on the condition of the patient, the peritoneal dialysis or hemodialysis also may be needed, and sometimes it is also very useful to save the life of the person who has taken aluminum phosphide and is in a critical state of condition. The post-mortem appearance, I told you, it is a garlicky like odor. The peculiar smell in the aluminum phosphide is garlicky, and in the enderun poisoning, I told you, it is kerosene like smell. So this garlicky odor is present at the mouth and nostrils and in the gastric contents. You may notice the blood-stained froth at the mouth and nostrils. The mucous membrane of the lower part of the esophagus, stomach and duodenum are congested, and there may be little less congestion in the small intestine as you descend it. So the lungs, the liver, spleen, kidneys and brain are also congested, and there may be centrizonal hemorrhagic necrosis in the liver. That is, hemorrhagic necrosis may be noticed in the liver. Another product is the zinc phosphide. Zinc phosphide is a steel grey crystalline powder. It is again a garlicky or fishy odor, and the symptoms are similar to those of aluminum phosphide, but they are usually a little slower because there will be slow release of phosphine when compared to that of aluminum phosphide. This is also used to preserve the grains, and it is also used as the rodenticide or the rat poison. here in this poisoning, the patients die due to pulmonary edema within few hours, and most patients die within 24 to 30 hours after exposure due to cardiovascular collapse. I told you because it has got a direct action on the myocardium, leading to myocarditis and other complications, and the patient will die within 24 to 30 hours. The fatal dose of zinc phosphide is 5 grams, and the fatal period I told you could be from 24 hours up to 30 hours. The treatment remains that shifting the patient to the fresh air if there is exposure due to the poisonous fumes, and if it is ingested, the stomach wash with potassium permanganate, and then installation of the milk after stomach wash, starch, or 3 to 5% of sodium bicarbonate is instilled or is inserted into the stomach, or dropped into the stomach to neutralize the gastric acids. And of course, the activated charcoal is to be administered to absorb all the leftover poison in the stomach, and sometimes even purgatives will help in elimination of the poison through stools. The postmortem findings, again it is garlicky odor or fishy odor in the contents of the stomach, and one pathognomonic finding is the blood may be cherry red as in coronary monoxide poisoning. There will be congestion and edema in the lungs, and there may be fatty necrosis of the liver. So these changes you will see in post-mortem findings in zinc phosphide poisoning. So once again, this aluminum phosphide or zinc phosphide is a popular rodenticide, insecticide and pesticide, and it is becoming a popular homicidal agent in our country. So when we come to the forensic importance or medico-legal importance of all these pesticides or insecticides or fungicides, rodenticides, whatever it is we have discussed, I told you in my last class also, the toxic effect or toxicity or poisoning with this is amount worldwide, it comes to about 3 million. And usually about 2 lakhs or 2 lakhs to 20,000 people die because of this insecticide poisoning or pesticide poisoning. And unfortunately, this poisoning is mostly in developing countries and mostly in India. See, in countries like UK, the pesticide poisoning, if you go by statistics, it will be less than 1%. But whereas in countries like ours, which are agriculturally, a country which depends mostly on the agriculture and rural India, the poisoning with the pesticides or insecticides is more, amounts to 60 to 70% of the deaths due to toxins or pesticides. This is because I told you it is not an ideal suicidal poisoning, but because of easy availability, because it is available very freely in the shops which sell manures, insecticides, pesticides. So the individual will procure very easily and consume, though it is a painful death. I told you The decision to commit a suicide depends on many factors, not only an ordinary a labor class or any person involved in agricultural labor. Even the highest strata of the people also commit suicides. So even we have seen the good upcoming personality in Bollywood, and many commitments also occurred in Hollywood heroes. So it is an impulsive decision to commit a suicide, and unfortunately here the organophosphorus compounds or agricultural pesticides are taking a major portion in committing of the suicides apart from hand use. Thank you. With today's class, I think we finished about the agricultural poisons and all pesticides and insecticides. In the next class, we will talk of some another poison. Thank you once again.